Hi, I'm Dr. Sheila Smitherman. I'm a neurosurgeon at Olympia Orthopaedics. I want to talk to you a little bit about your neurosurgical procedure today. Let's talk a little bit about your neck pain and your arm pain. Some patients will come to see me because they've got neck pain radiating to either arm or both arms, or numbness and tingling, or even muscle weakness in a certain muscle distribution. And that can be because patients have nerve pinching caused by bone spurs, a disc herniation, or something we call spinal stenosis, where there's compression of the spinal cord or nerve roots that branch off the spinal cord. Sometimes patients like you need surgery, and there are a couple of different kinds of surgeries that we can talk about. Some patients end up needing a disc replacement or a discectomy infusion, and that can be because of nerve pinching, such as on this MRI, where you can see this is a side view as if you're standing looking at the wall, and we've made a vertical slice through your spine. And you can see that the bones, which are these squares, are separated from each other by a disc that's cushioning between them. But this disc here is pushing up against the gray spinal cord that's floating in the white spinal fluid in the spinal canal. When this happens, the spinal cord and the nerve root that are branching off of that can become compressed and symptomatic. That means you have symptoms related to that nerve being dysfunctional. So if you come with me from here over to this picture, this is a cross-sectional picture of you as if you're lying down. Your feet are coming out towards the viewer, and we've made horizontal slices through your spine. So we're getting this picture. This is the spinal cord sitting in white spinal fluid, where there's a normal area, such as here. But down here, you don't see that white space anymore, and that means that your nerve is being pinched. So in this case, the nerve that branches off of here would give pain into the triceps area, into the forearm, and into the fingers. And if that happens, we might need to remove that disc to take the pressure off the spinal cord and the nerve. And that can be done with this kind of surgery called an anterior cervical disc replacement, or we say disc arthroplasty, or a discectomy infusion. Patients that have less degenerative change, not as much arthritic change, can sometimes be a candidate for the disc replacement, and others are a candidate for the fusion. But both are done with the same approach. Let me show you. This is a model of your cervical spine. This shows a front view of your neck as if you and I are standing next to each other. So your face would be here, and this is actually the back of your skull. So those bones in your neck are represented here in white, and the little gel cushions are the discs in between. So if that MRI we just looked at, where that disc herniation was pinching the C7 nerve root, was here, this is the disc. And the surgery to remove that, to take the pressure off of the nerve, is done by taking you to the operating room, and we get you off to sleep so you don't have to be awake for the procedure. And then we put you on your back, so your face is looking up at the ceiling. And then an incision is made on the front of the neck to allow us to get access to the spine and the disc that's affecting your spinal cord and nerves. Once I open the skin, I make a dissection between your esophagus and trachea. And then the pulse you can feel in your neck, which is your carotid artery, and then also the jugular vein. And there's a corridor between those structures that allows access to the spine. One thing that's important to know is that those structures are critical and can get injured during the surgery, so great care is taken to protect them, and that's a part of what takes time during surgery. Once those are protected and the spine is accessed, the discectomy is done by removing all of that disc material down to the spinal cord and nerve where they're being pinched. And once you remove that, you can either replace it with bone graft or a spacer containing bone graft, and then a plate that will anchor to the vertebrae and allow that to fuse together. Alternatively, if you have anatomy that would be favorable for it, you can have a disc replacement where an implant is put in that mimics the movement of the disc that you used to have. And that allows you to have some of the original flexibility to be able to move your neck in all of the directions that you used to. And that preserves your range of motion. After surgery, you'll go home either the same day or the next day, depending on how you feel, making sure that you're able to get up and ambulate or walk around. You'll work with our therapy teams to make sure that you're moving well. Our nursing staff will make sure you're eating well and that your pain is well controlled on some light pain medication that we can send you home with. And then you'll come see me at the office 2 weeks later for your post-operative check, where we'll start to plan for your physical therapy and getting you moving again. Thank you for joining me today. Thanks for giving me the opportunity to teach you a little bit about your neurosurgical procedure. If you have more questions or want to come for a visit at the office, please call my office or visit the website at olyortho.com.